Respiratory medications. Medications are given through the respiratory route or droplets inhaled into the lungs and bronchial airways using inhalers and nebulizers. This type of medication is used to treat pulmonary conditions like asthma and chronic obstructive pulmonary diseases, also known as COPD. Nebulizers are used as a rapid method through the use of compressed air, and it's generated into a fine mist. It is then inhaled into the bronchi and the bronchioles by dilating them.
Examples of medications given through nebulizers are albuterol. This can be prescribed as Ventolin or Preventil. I don't know how to say this other one, but it's known as Atrovent, acetylcysteine or mucomist. It's a mucolytic drug that is also used in the nebulizer.
And these are examples of nebulizers.
Those inhalers, they are pre-measured and amount of drug is pressurized and dispensed as a spray. It helps treat acute asthma. And then anti-inflammatory agents are delivered to bronchodilators for asthma management. On safety tips, it says caution the patient not to leave the inhaler in the car because hot temperatures could cause inhaler to explode or rupture.
A little bit about patient teaching. Make sure to shake the inhaler in order to mix the contents real well. Remove the mouthpiece. Hold 1 to 2 inches away from the mouth. In some cases, younger children or even older adults, they have a hard time with this. So spacers are available. As they're taking in a deep breath, make sure to tell them to hold it for 10 seconds. As they're taking in that deep breath, they spray the inhaler at the same time. And make sure to tell them to exhale slowly through pursed lips. If 2 puffs are ordered, wait 1 full minute and then repeat the steps 1 through 6. And then these are the different types of inhalers.
Important reminders for patients. We have to remind patients to rinse their mouth after using steroid inhalers because these prevent steroids from hanging out in the oral cavity. Then steroids used in oral cavity can cause oral thrush or yeast infection. That's why we ask them to rinse off their mouth and do not swallow the water. Then if using 2 different inhalers, use the steroid one last by waiting 5 minutes in between the inhalers and don't forget to rinse the mouth.
Dry powder inhalers. This type of medication is not pressurized canister rather than its powder form given through patient's inhalation to dispense the powder medication. Examples of dry powder inhaler are roto inhaler, spin inhaler, discus, and hand inhaler. This drug comes in flat disc and contains a number of small chambers with each dose of medication loaded. This is not used for patients with severe asthma because they cannot produce enough air to inhale the medication.
Under patient teaching, we have to teach the patient to slide thumb grip away from them to reveal the mouthpiece lever. Then push the lever to open the door to the medication chamber. Place mouthpiece inside the mouth with lips around it to close, for it to close into the medication, and then ask them to inhale. Take a deep breath and dry powder medicine is inhaled into the lungs. And for safety precautions, we instruct the patient not to exhale directly into the dry powder inhaler because the exhalation will disperse the powder, thereby reducing the dosage the patient gets. Okay, in patient teaching, we have to assist the patient to sit in upright position to help expand the lungs. Move the thumb away from the patient, or the patient should move the thumb away from them to open and review the mouthpiece. Hold upright so that the powder medication doesn't fall off. And then the precaution there is never shake the dry powder inhaler because they already come in powder form. Then move the lever away from patients to open the chamber. Instruct patient to inhale away from the DPI to avoid not getting enough. That should be exhale, I'm sorry. Then place the mouthpiece and ask patient to close lips around the dispenser. Inhale deeply and forcefully. Take a deep breath and hold it for 10 seconds. Then again, rinse the mouth after medication to be sure not to swallow the water. Then we have to evaluate patients after 30 to 45 minutes of medication.
Original order and ensure the accuracy of medication before administering any kind of medication. Highlighted or marked as discontinued. The abbreviation to use is DISC. No longer is DC used, so make sure not to make this mistake. Remember to always make sure that you are checking the MAR prior to administering any kind of medication. If the medicine is for PRN, make sure to check the time it was last given and the reason for administering the medication.
So this documentation continues. Say check back with the patient 30 minutes to an hour to see if problem has been resolved. If this is part of the evaluation from the nursing process. If the issue is not resolved, call the prescriber to document that prescriber was notified and include any new orders that he gave.
The system uses barcodes that are linked to the patient's chart or monitoring their medications. Patient information is recorded in the computer database, including, like we said previously, allergies, medications, also past or present illnesses, injuries, hospital visits, and any family history.
Presenting the medications given, we have to use two patient identifiers. So as the medication is automatically recorded and charged to the patient. Make sure to follow the facility policy because different software may require different documentation.